So our group decided to do our presentation on diversity and inclusion in physical therapy. Group members include myself, Trini Clifton, Mickey Hersey, Darren Johnson DeAugustine, and James Johnson.
In this presentation, we are going to start by defining diversity and inclusion. Then we're going to work our way into looking at the APTA Diversity, Equity, and Inclusion Action Plan. After that, we're going to look at a mini case study example. And then we're going to talk about the lack of diversity and inclusion and its influence on patients, and also how this impacts the field of physical therapy and underrepresented groups within the field. And then we're going to finish up with ways to increase diversity and inclusion in a clinical setting.
So we thought it would be good for us to start with some quotes that are relevant towards our topic. So this will just kind of set the tone of what our message is for this presentation. So our first quote states that we are all different, which is great because we are all unique. Without diversity, life would be very boring. This was stated by Catherine Pulsifer. And then our second quote states that inclusion is not a matter of political correctness, it is the key to growth. And this was said by Jesse Jackson.
Introduction: Defining diversity and inclusion. Diversity is the focus on the presence of differences among people in a group or population. This can include different backgrounds, races, genders, ages, religions, etc. Inclusion is the valuing of each individual's differences and equal access to all opportunities and resources despite these differences.
The APTA Diversity, Equity, and Inclusion Action Plan. APTA Diversity, Equity, and Inclusion Action Plan is a template that's about 6 pages long, and it goes through different ways that clinicians and clinics as a whole can improve their inclusion and diversity throughout the workplace. One of the main quotes that kind of talks about their purpose of this document is that the APTA DEI Action Plan comprises a set of guiding principles in 3 primary areas of action: allyship and advocacy, leadership and growth, and conscious inclusion. One of the other main aspects of this plan is that society benefits from a diverse healthcare workforce that is representative of a given community with diverse cultural competence, increasing positive outcomes. There are 7 principles included in the APTA Action Plan. The first one is benefits the work of the association and profession as a representation of all varied identities, differences, and intersectionality collectively and individually. 2. Ensures fair treatment, equality of opportunity, and parity in access to information and resources. 3 is about everyone. It helps to create a climate for a sense of belonging by actively inviting the contribution and participation of all people representing multiple dimensions of diversity. 4. Should be communicated in terms of its rationale behind DEI work so that everyone can see it as a key asset to the association and profession. 5. Recognizes the need to develop individual and collective understanding of DEI and their importance as they relate to APTA's mission and vision. 6. Honors the collective understanding of DEI and efforts in advancing the ongoing process of DEI work. And lastly, 7. Centers on our core values as a profession and our guiding principles as an association on equity and inclusion.
So in the following slides, I'll be going over some mini case studies that we came up with, and then we're just going to discuss what we see and see if there's any violations of any principles. So this is the first mini case study that we'll be going over, so I'm just going to read through it quickly. So this one states that Sally, a 45-year-old Latina woman with chronic hip pain from a long-standing condition, arrives at a physical therapy clinic for an initial evaluation. The physical therapist notices that Sally speaks Spanish, but she does prefer to speak English in healthcare settings. The physical therapist does not make an effort to ensure she fully understands the treatment plan or provides her with culturally sensitive care. The therapist continues to use technical jargon without checking if Sally fully understands. When Sally appears confused, the therapist dismisses her concerns, assuming that she will figure it out later, and doesn't offer a translator or written materials in Spanish. So when we analyze the first case study, we can see that there is a violation in Principle 2 specifically. Overall, the physical therapist was not ensuring fair treatment towards the patient. And some details that we picked out from the case study that kind of validates that is that the physical therapist was not providing access to a translator for the patient. They also weren't providing any written materials such as instructions in Spanish, which is the patient's first language. And then also the therapist wasn't being conscious of the terminology that they were using around the patient. So some changes that would need to happen in this scenario is that the physical therapist should ensure that resources such as a translator are provided if there is a language barrier. And then also they should ensure that written material in the patient's language is provided during the treatment. And then lastly, just making sure that the physical therapist is communicating in a way that the patient will fully understand.
Lack of diversity and inclusion and its influence on patients. Lack of diversity leads to lack of care. Rehabilitation methods are usually specialized to meet the needs of the majority population. This can exclude the values and needs of all cultural groups. A patient's beliefs and values can influence the way they want to be treated by a physical therapist. If the physical therapist is not culturally competent, the patient might become uncomfortable with the treatments due to the difference in values and beliefs. Patients can be misdiagnosed due to misinterpretation. If the physical therapist does not understand the patient's language or description of their injury or pain, the patient could be mistreated. In the study done by Kawathakar and Campbell, they found that physical therapists can better treat patients if they have cultural competence. In order to have cultural competence, you need cultural awareness, cultural sensitivity, cultural knowledge, and cultural skill.
Current underrepresented groups in the field of physical therapy.
2021 Diversity in Physical Therapy compared to the U.S. Census. This data was collected by the APTA and highlights diversity in the field with both physical therapists and PTAs. This data shows how some races and ethnicities are underrepresented in the field of physical therapy. The percentage of people who identify as white, Pacific Islander, and Native American are all very similar to the actual makeup of the U.S. population. The underrepresented races and ethnicities in physical therapy are those who identify as Asian, Black or African American, and Hispanic. Diversity in board-certified specialists. This data is also from the APTA and shows the distribution of board-certified specialists across races and how most of the races are underrepresented. The APTA also gathered this data relating to genders and found that the ratio of board-certified specialists, female to male, is similar to the overall field at roughly 65 to 70% female and 35-30 male. This is not seen at the individual specialties though. Geriatric, neurology, and pediatric are dominated by females, with the highest one being pediatrics at 95% female.
Ways to increase diversity and inclusion in the clinical setting. 4 ways to implement DEI in the workplace. 1. Challenge unconscious biases that you may have formed in the past. 2. Adopt inclusive languages to involve all. 3. Celebrate and embrace cultural differences. And 4. Foster opportunities for coworkers to connect. If a physical therapist is not following the APTA's Code of Ethics, there are things you can do in order to combat this problem in the future. 1, you can document any incidences that take place that violate the Code of Ethics, just so you have information if you have to go forward with it. 2, if suitable, address the issue directly and have a private conversation with the physical therapist that is not following the Code of Ethics. And then 3, if they do not change their behavior, report the violation of the APTA Code of Ethics to the State Licensure Board and APTA's Ethics and Judicial Committee to be further investigated.